Hello, everyone. Welcome to another episode of Mental Health and Makeup, and I am your host, Jasmine Young. I am a psychiatric and mental health nurse practitioner, and on today's show, we're going to be talking about bipolar disorder. Okay. All right. So, what have you all heard about bipolar disorder? Negative, bad things, right? We never hear anything good about bipolar disorder. But you know what? It's just because people don't understand it. And so that's why I'm here to help you all to be able to understand what bipolar disorder is exactly. Okay. All right. So with the bipolar disorder, number one is hereditary. You hear bipolar. So it makes you think of two poles, bipolar. So bipolar disorder has to do with a person that has both depression and mania. Now, this is hereditary, okay, as is most of all mental health disorders, okay, most of all of them. There are some that people acquire, like PTSD, but we'll get to that on a later show. So, bipolar disorder, you have someone who's depressed and you have someone who is also manic or hypomanic, okay? Of course, today I am using our handy dandy DSM, okay, if you all want to follow along with me. I'm not really going to be coming directly from the DSM because I know all about bipolar disorder, but I want to let you all know about the big book, and it's on page 124. So with bipolar disorder, your chances increase. Your chances increase. You're more likely to have it if your parents are depressed or bipolar. So again, we have to look at family history. Who's your mama and where's your daddy? That's what we look at. Family history. All right. And so if your family member has been depressed or having a lot of mood swings, then they could possibly have bipolar disorder. People come to me in the clinic and they say, Jasmine, I've been depressed and I've taken so many different medications, but none of them seem to work. They'll make me feel a little bit better, but in the long run, I just don't feel good. Sometimes they make me angrier. And yes, if we treat someone that has an underlying mood disorder, like bipolar disorder, with an antidepressant alone, like choose your favorite antidepressant. Which one? Okay, is it escitalopram? Is it paroxetine? Is it fluoxetine? If we treat someone who has an underlying bipolar disorder with the antidepressant alone, it could cause signs of mania. Okay, so it's all about the diagnosis. And some shocking statistics about bipolar disorder. I always start my assessment for bipolar disorder out like this with my patients. I always say 1 in 4 people misdiagnosed with major depressive disorder by their primary care physicians are actually bipolar. 1 in 4. Isn't that a shocking statistic? Another shocking statistic. How long does it take on average to be diagnosed with bipolar disorder? The shocking statistic is between 5 and 10 years. So you're basically looking at a person who has signs of depression. We already kind of talked about before, and of course I'll go over them if you all need to hear that. Feeling very down or sad, sleeping too much or too little, having a little appetite, feeling like you can't enjoy anything, feeling like you're not doing like the things that you used to do. It's called anhedonia. Feeling worried a lot, trouble concentrating, forgetting things a lot, sometimes even having suicidal thoughts. Feeling tired or slowed down, we call that psychomotor retardation. And changes in appetite or weight, like overeating, emotional eating, just eating anything, or not eating at all, decreased appetite. So those are signs of depression. And if you have depression, you have at least 5 of those signs over the last 2 weeks, and it's totally different from your previous, it's a change in your previous level of function. Yeah, that's depression. But is it just depression? Okay, because if it's just depression, you shouldn't have mania. All right. So we said that bipolar disorder is genetic. It takes 5 to 10 years to figure out, basically on average, if a person has bipolar disorder. And you take a lot of medication, and sometimes they make you manic. Sometimes the medications will make you sleep less and be all over the place, spend a lot of money, having a lot of sex, doing drugs, doing things that's not part of your personality. Not sleeping and having problems sleeping. So if you're sleeping 8 hours, 8 hours, 8 hours, and all of a sudden you can't sleep, or your sleep just dramatically decreases, and then you have this manic episode where you're all over the place, then you may have signs of bipolar disorder. But in order to be bipolar, you actually have to have mania or hypomania at some point. And you all can see why it's very, very difficult to diagnose bipolar disorder, because someone's got to be a good historian. Don't come to the clinic and not have actual times that you felt manic in your head. Yes, I'll ask you 13 questions, and it's called the Mood Disorder Questionnaire. I'll ask you these questions, and if you score over a 7 or more, then you're most likely bipolar. But I just don't go off of paper. I just don't diagnose someone off of just a paper or a screening. That's a screening tool. But I go in depth and make sure that you have a manic episode, because in order to have bipolar disorder, you have to have one manic episode in life. In life, y'all. Where you're sleeping less and you're basically all over the place. Okay. And I want to discuss mania. So we talked about depression. Let's talk about mania. So a bipolar 1 disorder, because there's so many different types of bipolar disorder. There's 6 different types of bipolar disorder. Did you all know that? Yes, 6 different types. A lot of people say, oh, I don't have bipolar 1 disorder because I don't act like my cousin. My cousin has bipolar 1 disorder, and my cousin is crazy. My cousin, I don't act like that. Oh, no, I could never be bipolar. Well, number 1, he's your cousin, right? Or she's your cousin. So it's in your DNA. It's in your DNA. So don't say that it can't be you. Because if you've taken a lot of different antidepressants and they're not making you better and they're not taking your depression away, then something's not right. Something's not right. So I encourage you to go ahead and be honest with yourself and ask yourself, could this be bipolar disorder? And then go get seen. Go get seen by someone that can help you determine if it's bipolar disorder. All right, so we're going to go over mania. Okay, guys, I messed that up. We're going to go over mania. And some people use that word like they throw it around. They'll say, so-and-so is manic again. Y'all don't do that. Can we not do that, please? That's like using a term, a diagnostic term, flippantly. And see, this is why people with bipolar disorder have this stigma, because people go around saying things like, you're bipolar, oh, you're acting manic. Don't go saying those things if you don't know exactly what mania is, okay? Because it's very unfair. All right. So mania is a distinct period of abnormally and persistently elevated, expansive, or irritable mood. An abnormally and persistently increased goal-directed activity or energy, lasting at least 1 week and present most of the day, nearly every single day, or any duration if hospitalization is necessary. So if someone's requiring hospitalization because of not sleeping and their mood is all over the place, then yes, that is one of the criteria. You will meet criteria. And during the period of this mood disturbance, this person has 3 or more of the following symptoms. Okay. All right. So if you're questioning if you're bipolar or if you have bipolar disorder, go ahead and get your pencils out. I need y'all to be writing this stuff down, okay? Because we've gone over this before, but you all like this format better, okay? Because y'all like drama. Y'all like drama. Okay, because this is very dramatic. Bipolar disorder. Have you ever seen anyone that's manic? I mean, it's not a funny thing, but at the same time, you seeing this person, they're talking fast and they're moving fast. They're all over the place. They're spending a lot of money. They're having a lot of sex with multiple sex partners. They're all over the place. I have some people coming to me saying things like, yeah, I don't drink, but every now and then, like maybe once a month or once every 2 or 3 months, I'll find myself going to the bar. One lady even told me that, she went to the bar and drank more than one drink when she usually only drinks one drink. She had 2 or 3. And then she was like, okay, I'm going to meet some friends. And she's not even a friendly person. She doesn't even like to meet people. But that night, she couldn't sleep and she felt froggy, like she wanted to jump. So she jumped. I mean, this is totally against her personality. Dancing on the bar, and the bartender looking at her like, are you okay? This is not something that you do. And everybody kind of looking like, yeah, we're kind of going to go along with her. But no, she really doesn't do things like this. So what is she doing? Also, she told me that she was promiscuous as well. So that is another sign of bipolar disorder. Or more specifically, mania in bipolar disorder. Sexual discretions. Now, I don't want y'all going out here cheating on each other and having all types of sexual discretions and then trying to blame bipolar disorder. Oh, I can't be faithful to my girlfriend. I can't be faithful to my husband because I have bipolar disorder. No, don't use that as a crutch. I have patients who try to use that as a crutch, and that is just not cool. Because when you know better, you're supposed to do better. You're not supposed to use your condition, to get away with cheating. Come on. Y'all are way better than that, right? But you tried it. But no, just because you're bipolar does not give you the right to go and cheat on people. I know there's going to be some people out there saying, ooh, I'm bipolar. I may be bipolar, so I'm just going to cheat. No. And as a matter of fact, let me give my disclaimer before I get too far. This is not intended to diagnose anybody out there with bipolar disorder. Okay. Just because I do it in clinic doesn't mean I'm going to do it on here. This is just for educational purposes. Okay. All right. So back to mania. Have you all ever seen anybody that's manic, that appears manic? They may feel very high or up, jumpy, wired, not feeling tired. They don't feel tired. Or they may just need a little bit of sleep, 2 to 3 hours versus 6 to 8 hours on average. They may talk really fast about a lot of different things. One lady told me, she said, Jasmine, I talked so much that I ran out of breath on the phone. I guess she was talking on the phone, and she said she was talking, and she was talking so fast about so many different things that she ran out of breath. And I thought, wow, that's a lot of talking. So it's just not being chatty. Like most people who know me know that, I like to be chatty. But I don't run out of breath. Do you all do that when you put your makeup on? So if you find someone that's super duper chatty and they can't stop talking and then they're all over the place, they're being very impulsive. One lady told me she goes to Walmart or Target, one of them, and spends hundreds of dollars. Hundreds. They shop a lot. People with mania, oh, they shop. Oh, they shop. And it's really not something that was planned. They'll go out and purchase, just on a whim, they'll purchase tickets. They'll purchase flights. They'll purchase vacation packages. They purchase a lot of different things. And then they get home and they're like, why did I buy that? Like, what was wrong with me? Why did I feel like I could just break the bank? And they just feel good. I want to let everyone know, mania is not a bad feeling, okay? Mania feels good. Because you're looking at a person who's been depressed, number one. They've been depressed for a while. Because most people will spend 68% of the time depressed. People with bipolar disorder, they'll spend 68% of the time depressed. and around 13% of the time manic, and around 19% of the time having a mixed set of symptoms. The mixed presentation is like a little bit of this and a little bit of that. If depression was on this side and mania was on this side, then a person that had a mixed episode of bipolar disorder would have a little bit of this and a little bit of that. So feel depressed, but then maybe they have a lot of energy. Or maybe their mood and their energy is going in different directions. So like their energy is very high, but their mood is tanked. Maybe they're just very pessimistic, and they have a lot of energy and they're talking fast and moving fast, but they're just pessimistic, and the only thing they can do is be pessimistic and negative. Maybe they're exhausted, but they're overly anxious. So exhaustion and then being overly anxious at the same time, those are signs of a mixed episode, a mixed manic episode of bipolar disorder. Okay. And that's when people tell me, Jasmine, I just feel like I'm just going crazy. And I say, well, why do you say that? And they say, because I'm talkative, but I'm being very negative. I'm exhausted, but I'm all impulsive. I have too much energy, and I'm just like sad, and I have all this energy, but I'm just like sad. One person told me that the energy is increased, and the energy actually feels like, they said that it feels like they're plugged into a socket, like an electrical socket. Yeah, can you imagine that? That doesn't seem like it would be too fun. And they tell me that they just get restless, but they like it. They like that. So when I treat someone's mania and bring them down, a lot of times they don't like it. I want to let you all know, being manic is not healthy for your body. If you have other problems like high blood pressure and things and sleep-related issues and things, it can really affect your health. So we've got to, and the decisions that a person with bipolar disorder makes could affect your life decisions and life choices and get you into trouble. I mean, can you imagine, buying tickets to a concert that are $600, but your rent is $600? So then after you buy your tickets, you're like, why'd I do that? Because I should have paid my rent. But you were in a manic episode. But that doesn't mean you use it as an excuse, okay? I'm educating you all here so you'll learn the signs of a possible underlying mood disorder. Please don't ignore it. Don't ignore the signs. All right, so treatment options are available, But first, we have got to get the diagnosis down. So basically, we've diagnosed you with major depressive disorder, okay? And we've treated you, or maybe your primary care has treated you with antidepressant, something like Lexapro, something like Paxil. There's so many of them out there. Choose your antidepressant. And then it didn't work. So you say, nope, this didn't work. This isn't the right thing. And so, okay, we go back to the drawing board. And we say, well, if that's not the right thing, let's try this one. And you say, okay, we're going to try a different antidepressant now. All right, and you say, okay, we're going to go ahead and try to push this one up because maybe it's not at a good level, So then let's just take Lexapro. Say we increase your Lexapro from 5 to 10, and you do fine. Then we increase your Lexapro from 10 to 20, and you start sleeping less and being all over the place. Then you come back and you say, Jasmine, I did exactly what you said could possibly happen. I started not sleeping, and I've been very erratic. I've been very impulsive, and I'm feeling very high up, jumpy, and wired. Then yes, we most likely have exacerbated an underlying mood disorder. But don't be dismayed. We can fix that. So let's look at the receptor level information, down to the receptor level when it comes to bipolar disorder. Like, what's happening? Well, in a few areas of your brain, you have too much dopamine, Okay, and dopamine is the feel-good chemical. It's a very powerful chemical. But when you have too much of it, oh boy, it could really mess you up. So that's one thing that we don't want. We don't want a bunch of dopamine, okay? In a person with bipolar disorder, oh no, it's just not good. So we have to decrease the level of dopamine in the brain. Okay, so you say, well, how do you do that? We use antipsychotics, okay, like Abilify, Seroquel, Zyprexa, Geodon, and those are the brand names of medication. The generic names are the ones that you all will probably get. But again, don't go into your doctor's office saying, I want some of that Geodon, because they're going to look at what's best for you. Okay, we're just speaking in general right now. All right, so we use the antipsychotic to bring the dopamine levels down. Okay, the antipsychotics are totally different. But what I tell people to look out for with the antipsychotics, because all of them, although they're different, they all have the same kind of side effects. They can increase your cholesterol, they can increase your blood sugar. And so I always want to get like a fasting set of labs. If you come to me and you already have your labs done, that's fine. I'm going to need some labs though, okay? Because when I put you on this medication, I've got to see, okay, is this going to make their blood sugar go up? Is this going to make their cholesterol go up? And I mean, if you do have those issues, yeah, we're just going to have to work on them, because you're going to have to take some medication for bipolar disorder, okay? If you're having signs of mania. I'm sorry, but you're just going to have to do it. You're just going to have to take it, okay? And you're just going to have to eat right, and you're just going to have to exercise. And that's what I tell my patients. Look at here. You come to me for help. You want to treat it, but then you don't want to stop eating, or you don't want to start exercising. Because if you take these medications, one thing about it, people, if you take these medicines and you're already diabetic or you already have heart disease, it could exacerbate that. Do you want that? No. We don't want that. And some people will tell me, no, Jasmine, I'm just not ready for that. I'm not ready to change the way I eat. I'm not ready to change. But if you have bipolar disorder and it's affecting your life, you're going to have to treat it. So you're going to have to change, okay? And then that's when I will refer you to therapy for you to get your life right. Y'all got to get your lives right in 2021. I'm telling you, don't wait for 2022, please. We don't have time. This is a part where it's kind of hard. So I have to put this on, then talk. Okay. So, some people say, well, I don't think I'm going to be able to identify signs of mania, or man, I don't even know what you're talking about when you say mania. So I send them home with a mood chart, something like this, or something like this. This is my favorite one. I'll email them this. And basically, I'll have them chart their hours slept against their mood, whether their mood is low. I don't like the word normal. What's normal? I like stable. Or whether they have a high mood. All right, so we go here, and over time, this is 1 month, over time, we'll be able to identify when your sleep changes from 8 hours to none, or 1 and 2, and your mood is very high for a few days. Oh yes, that's an episode of mania. And how many episodes of mania do you have in 1 month? And while we're titrating medications, while we're moving medications up, how many of those little, pictures do we see on your mood chart? By the time people come back to me and they have their mood chart complete, they have already identified the episodes of mania. So they learn. And they say, oh, that's what was wrong with me. I was having an episode of mania. So, wow, I guess I'm bipolar. Now, don't go diagnosing yourself as being bipolar, okay? This has got to be done by a medical professional in psychiatry, a psychiatrist or a psychiatric nurse practitioner or physician's assistant, okay? You do have some psychologists that can identify bipolar disorder. with certain degrees and in certain states. But for the most part, this has got to be tracked. Remember, guys, it takes on average 5 to 10 years to get this diagnosis. So this isn't anything that we do flippantly or haphazardly. Oh no, because once you give someone a diagnosis of bipolar disorder, okay, now we've got to treat it. Okay. All right, so we're not going to treat you to a fault. I'm not going to turn you into a robot. You're not going to be robot Jasmine or robot shell of yourself. You're just going to feel even keel. So we'll give you a mood stabilizer if you feel, you need a little extra help. We'll give a mood stabilizer. We'll start with the antipsychotic, or maybe your doctor started with an antidepressant. We'll maybe add an antipsychotic or decrease the antidepressant. And then we may add a mood stabilizer like Depakote, lithium. I love Lamictal. It's one of my favorites, but gotta watch out for a rash with Lamictal. So there are ways to treat bipolar disorder, but it's in the follow-up. You got to follow up, okay? Because once we diagnose someone with bipolar disorder, okay, you're depressed. We're gonna lift the depression, but if you're manic, we have to decrease the mania as well, okay? And the only way to do that is to monitor how you feel week to week, day to day during treatment. And you've also got to watch out for 2 symptoms. I don't know if I said this before or not. Involuntary movements, we call them EPS, extrapyramidal symptoms, and also akathisia. Akathisia is the feeling of wanting to move. It's a restless feeling. Like, oh my goodness, I can't sit still. I gotta move. I gotta move. I had a teacher once tell me, man, I can't take this Abilify. I can't take this medication. I don't want to give Abilify a bad name, but I don't want to take this medication, Jasmine, because I'm a teacher and I have to sit down for 8 hours and I can't sit down when I take this medication. So we just switched her medication. Okay, so you've got to be in talks with your provider about how the medicine is affecting you and how your mood is being stabilized by the medicine. Because the goal of therapy, of medication therapy and cognitive behavioral therapy, is to have your mood nice and stable. Have your sleep nice and stable between 6 and 8 hours, and your mood nice and stable. Okay. And I have successfully treated bipolar disorder. Okay. So if you're a person that has mood swings, or you're depressed, you've taken a lot of antidepressants and none of them work. Maybe they work, but then maybe they cause insomnia and cause mania. Then there could be an underlying mood disorder. It could be a bipolar 1 disorder. It could be a 1.52, 2.53. Like I said, there are 6 different types of bipolar disorder. And then dysthymia, cyclothymia, a lot of different mood disorders, okay? Just trust the process and know that the follow-up is the most important. Okay, don't go get this diagnosis and then not follow up, okay, because you're going to have to be treated, okay? All right, so how did it go, guys? What do you all think? Depression, we use an antidepressant, you should get better. If we use an antidepressant and it causes mania, there could be an underlying mood disorder, which don't be scared. Don't be afraid. All we do is add a antipsychotic, or we add a mood stabilizer, or both, okay? Or we'll take the antidepressant down some, and then add an antipsychotic on top of that. Okay, always remember, ask questions about the medications, because if you're going to take an antipsychotic, you're going to have to look at diet and exercise and how you're taking care of your physical health, okay? And of course, we order labs, and then we tell you, we recommend when you should go back to your primary care for routine labs if we see something, or if we see some labs off the chart. Of course, we're not going to diagnose anything medical, but we're going to go ahead and send you back to your primary care with those labs that are off for them to work up whatever's going on with your labs. All right, so I'm finished with my makeup today. I didn't put on lashes today, guys. Maybe I'll do that next time. But I want to thank you for joining me for today's episode of Mental Health and Makeup. And I'm your host, Jasmine Young. I look forward to seeing you next time. Bye.